My name's Laura. I'm here to stand up for the Affordable Care Act because back in 2010, when I was a 23-year-old grad student, I was able to be in my mom's insurance plan because the Affordable Care Act raised the age of dependence up to 26, and without that I would not have been able to afford health care as a student on the private market because I have a lot of pre-existing conditions, so the premiums would have been too high. I was born with a lot of birth defects. I've had over 30 operations in my life. I'm 28 years old right now. I have about 5 different doctors I see. I need regular tests and scans every year too. And that's just to maintain my health. That's not factoring in any additional health care that I'd need if I were sick or had an illness. So for me, health care is very important. And right now I do have health care through my employer. I work as a speech therapist, but if I were to ever face unemployment, again, the Affordable Care Act would be really essential. And I want to take a minute too. People are talking about going back to things like state-run high-risk pools or lifetime insurance caps. And back in 1989, my parents said that they had to estimate when I was 9 months old in January that I would hit my $1 million lifetime cap, and I did. So they had to enroll me in the Connecticut high-risk pool. And I guess for the year of 1989, they spent around $15,000 just with premiums and deductibles, and that was just for me, not factoring their health care too. So for one person in 1989 it was $15,000, and if you factor in things like inflation, to now, 28 years later, that's not acceptable. It's not affordable. So that's not an okay alternative to the Affordable Care Act, going back to that model. And as a speech therapist, I work with a lot of kids who have a lot of special needs and a lot of complex medical issues too. And I'm sure healthcare is a big issue and something that's very important for those families as well. So I would like to urge you to please stand up for the Affordable Care Act and support it, because a lot of people like me with pre-existing conditions really depend on it. Thank you.